Hey, what's going on? This is Edward Williams. I'm the founder and creator of Health by Necessary, and what you're about to experience is the definitive guide and #1 course on high blood pressure. In this presentation, not only am I going to tell you about high blood pressure, but I'm also going to talk about how you got high blood pressure and also what you need to do to improve your blood pressure. Now, the steps that I'm going to give you as far as reversing hypertension and improving your blood pressure is going to be practical and sustainable. As far as my credibility goes, I've been helping people do this for over 5 years. I've helped hundreds of patients and clients radically improve their blood pressure and overall health, specifically in the areas of blood pressure and type 2 diabetes. This video is going to go in depth as far as blood pressure, but it's going to be very simplistic in nature. Now, I want you to make sure that you watch the entire course, because at the end of this video, I'm going to come back, I'm going to wrap things up, and I'm also going to show you how you can take advantage of a huge special offer we have right now on one of our herbal stacks called REVOLT. REVOLT is our best-selling herbal stack that we have for high blood pressure, and I'm going to show you how you can take advantage of a huge offer we have going on right now. So make sure you sit back, relax, take notes, and watch the whole video, and I'll be back to wrap this whole thing up. All right, I'll holler at y'all later. Peace. Hey, what's going on, everybody? Welcome to the course, The Truth About High Blood Pressure, the mini course. So once again, my name is Edward Williams. I'm the creator and founder of Health by Any Means Necessary, and in addition to that, I'm also a physician assistant. Now, that's enough about me. Let's go ahead and get right into it. So what is high blood pressure? Well, first I want to start off by talking about what it is not. And it is not a disease. I know that's what most of us have been taught and conditioned to believe, but it is actually not a disease. Now, we hear this term being thrown around so much, but the actual term disease actually has a definition. And you're going to soon see that the high blood pressure does not meet the criteria to be considered a disease. So let's look at this definition real quick. A disease is a disorder of structure or impairment of function in a human, animal, or plant, especially one that produces specific signs or symptoms. Now, I have bolded a couple of key words: disorder, impairment, signs, or symptom. Now, as I go through this mini course, I want you to keep this definition in front of your mind, because you will soon see that high blood pressure is not a disease, but instead it is a healthy, adaptive mechanism that is in place to maintain homeostasis in order for your trillions of cells to be properly perfused. Once again, keywords: disorder, impairment, signs, and symptoms. Now, your blood pressure increasing upon demand is not a disorder. In fact, it is the complete opposite. This is a healthy, adaptive response in the time of need. And so we're talking about adaptive physiology, and adaptive physiology is not a disorder. Now let's talk about signs and symptoms. So first, let's define both a sign and a symptom. A sign is something that both parties can actually bear witness to as to being real and true, and we can actually measure it, and we can actually see actual evidence. So if someone says they have a fever, well, I can actually measure your body temperature and see that it's 101, and we can say, all right, cool, you do have a fever. If you say that you have an increase in heart rate, well, I can actually measure your heart rate. If you said that you lost weight, well, I can actually measure your weight. So we can both bear witness and verify that what you are saying or claiming is actually true. Now, when it comes to a symptom is something that only can be experienced by you, the actual person themselves. So if you say you have back pain, well, I can't feel the back pain. I don't know exactly what level of pain you are feeling. Nonetheless, that doesn't mean that your back pain is not real, because you actually feel the pain and it's very much real for you. Same thing with the headache. I can't measure your headache. I don't know the actual pain level of your headache, but nonetheless, you are saying that you feel this. And so those are the actual differences between signs and symptoms. Both of them are very much important when coming up with the diagnosis. So as far as high blood pressure goes, what is the actual sign for high blood pressure? What measurement, what supporting evidence can we use to actually verify high blood pressure as a diagnosis? Now, most people are probably thinking, well, the actual measurement of your blood pressure being high is an actual sign. But here's the thing. You can't use a sign to be a sign to say that that sign is now an actual disease. The disease, which in this case is actually just a sign, needs supporting evidence. What supporting evidence can you use other than the actual measurement of your blood pressure? There is none. There is none. Now let's move on to actual symptoms. Now, what symptoms do people feel when they have high blood pressure? Now, the classic symptom that a lot of people will say that they feel and they know that their blood pressure is increased is a headache. But here's what's going on in most of these cases. When you have a headache, that is painful. And when you have pain, in most cases, your blood pressure is supposed to increase. There's supposed to be an increase in blood flow because of that pain. So when most people are actually having headaches, it's not because their blood pressure is high. Their blood pressure is actually high because they're having a headache, and a headache is actually painful. And in addition to that, when we look around and see what the general consensus is as far as symptoms for high blood pressure, there is no general consensus. You're not going to find in any medical text a laid out symptoms for high blood pressure. And this is why it's mistakenly called the silent killer. Mistakenly called the silent killer. Now let's move on to diagnosis. Now, diagnosis actually means to find the cause. Now, high blood pressure can't be diagnosed. Now, taking that very definition of finding the cause, what you need to know that 90 to 95% of hypertension cases are considered to be essential hypertension. Now, essential hypertension on the low actually has two definitions, but we will talk about the 2018 definition. Essential hypertension essentially means that we don't really know what is causing your blood pressure to be increased. They also call that idiopathic, meaning that the cause is unknown. Now, let's look back at diagnosis again. Diagnosis actually means to find the cause. How do you find the cause of a quote unquote disease that you named essential hypertension, denoting the fact that you don't really know what's causing it, and you're saying that it's idiopathic, and now you're going to diagnose it, but you can't diagnose it. By their very own rules, you can't diagnose it if you're calling it essential hypertension, meaning that we don't know what's causing it. So that debunks, that just throws it out the window right there. Now, also something that's extremely interesting to note is that the term essential hypertension originated in the 1800s by a physician named Richard Bright. And Richard Bright named it essential hypertension because he understood, and the doctors at that time understood, that the blood pressure increasing was due to the fact that there was constrictions in the arteries, the smaller arteries, in fact. And so it was essential for the blood pressure to increase in order to continue to perfuse the vital organs with blood. And this is where the actual term essential hypertension came in play. They weren't calling it an actual disease. They were calling it an adaptation that was actually needed because of the actual constriction that were going on in the arteries. And that's extremely interesting because that's where the actual term comes from. Now, let's keep going. Why is this so important? Well, it's important because being told that you have something and that it is a disease actually shapes and molds how you're going to deal with it. Most people's next line of question deals with how to get rid of it. The question instead should be, what is the actual function of this mechanism? Now, to actually figure out the function of this mechanism, blood pressure, high blood pressure in this case, we're going to have to do the Missy Elliott method, which is flip it and reverse it. Now, I'm not going to say the next line because I'm not going to sit here and look crazy. But another way to call this is pretty much reverse engineering. When I was growing up, there was a show called The Magic School Bus. And essentially, it was about this crazy, loony bus driver who every single day took these kids off of campus without any kind of permission slip. And she would go out and invade the body of some kind of human or some type of animal. And if they wanted to actually figure out the problem, what they did was they made themselves extremely small and they went down to the very basics of that thing that they were actually trying to figure out. And a lot of times it will lead them to the actual cell. And so that's what we're going to do. We're going to flip it and reverse it, reverse engineer, and we're going to go all the way down to the very cell. So what you may not know is that your body is made up of 37 trillion cells. 37 trillion cells. That's with a T, not a B, not an M, with a T. 37 trillion cells. That's a lot of cells. And so when we're looking at this, essentially, we're talking about everything in your body being made of cells. Everything from your kidney to your liver, your bones, your lungs, your brain, your blood, your heart, everything. And this is the way it works. A group of cells get together and they create a tissue. Tissues get together and they create an organ. Organs get together and they create the organ system. And then the organ system is you. Now, you can take that and flip it and reverse it and go right back down to the very cell, and then flip it and reverse it and go right back up to the actual human. So we see that in this case, the micro is actually the macro, and the macro is actually the micro. We've all heard the saying, as above, so below. And we understand that there's a duality, and that duality is actually really the same, but on a smaller level. And it's the same thing with your body. So in this case, if you understand how to take care of the cell, then you understand how to take care of the human. And if you understand how to take care of the human, then you understand how to take care of the cell. So if someone tells you that you're not the same person that they used to know, don't get mad at them, because they are absolutely right. And you don't want to be the same person that they used to know, because everything in nature is constantly in motion. Just look at this intelligence. So 300 billion new cells every day is created by your body. Your body creates 300 billion new cells every day, and 200 million cells per minute. So that means by the time we get done with this presentation, by the time I get done with this actual sentence, you would have already created newer cells. Hundreds and thousands of cells are being created right now as I'm speaking within you. And so every day you literally have the chance to be a better version of yourself than you were the previous day. Now, once again, 37 trillion cells. I want to make sure we grasp that, because that's a lot of cells. That's a lot of cells. Now, each one of these cells have needs. They have demands. All of those cells, they need nutrients, they need oxygen, and when they use the nutrients and oxygen, they have a byproduct, and that byproduct produces waste, and that waste has to actually be disposed of properly. And so 37 trillion cells all doing essentially the same thing. They all have essentially the same needs, and they all create the same waste, and they're extremely busy. There's no days off. What's actually supplying those needs to the cells? That's where your blood comes into play. Your blood comes into play because your blood is what is actually supplying the supplies to those cells. It's supplying the actual demands from your cells. So let's look at the function of blood. So we're talking about red blood cells. I mean, this is something that we don't consciously think about very often at all, but your body could not survive without it. Each human, like I said, has trillions of cells, and each one of those cells require blood to not only survive, but thrive. So here's just a couple. I'm not going to read the whole entire slide word for word, but just a couple of the actual functions. It supplies oxygen, nutrients, it removes waste, it has immunologic functions, it plays a role in coagulation. It also plays a role as far as the actual messenger functions. It transports hormones, repairing of tissue damage, regulating pH, your body temperature. I mean, it does so much. So that's just to name a few of the functions. And there, of course, is plenty more. Now, as you can see, blood is of extreme importance to our health, and it has many vital roles. Without blood, our cells simply could not survive. In medicine, we call this process ischemia, or hypoperfusion, or hypoxia. Your body will adapt and regulate as much as it can to prevent this from happening, including increasing your pressure, including increasing your blood pressure. So now that you have an idea about what blood does and the importance of having a constant supply of it, let's now talk about how it gets from one place to another, because this will be another important aspect for us to dissect and put back together in order for us to understand where we are going. So as I mentioned before, you are made up of trillions of cells. And when it comes to getting the blood to all your cells, your body has a whole entire system set up in place that performs this function called your circulatory system. Your circulatory system consists of 3 independent systems that all work together to get the job done. This is your cardiovascular system, your pulmonary system, and your vascular system. Your circulatory system can be likened to the highway system or a plumbing system as far as the actual design, but the metaphor is very limited, whereas an actual highway or plumbing system is inanimate. Your circulatory system is very much animate. It's dynamic, and it's responsible for meeting the demands for the delivery of your blood, your nutrients, your oxygen, and other gases, and as well as the hormones to and from those cells. As I mentioned before, the circulatory system is huge. In fact, the circulatory system measures 60,000 miles long. Now, just to get an idea of how long that really is, I need you to think about this. The circumference of planet Earth is 25,000 miles long. This means that the human circulatory system could go around planet Earth 2.5 times around. Now, everybody should be saying wow right now, because that is incredible. As you can imagine, with over trillions of cells, 60,000 miles of blood vessel for blood to travel through, there's a lot that could potentially go wrong along that journey. Because of this reality, your body has multiple adaptations, mechanisms, and regulators in place to make sure that in the likelihood that something does go wrong, these regulators and these adapters will activate to make sure that blood is delivered to your cells by any means necessary. Once again, I'll repeat, without blood, your cells simply could not survive. In medicine, we call this process ischemia or hypoperfusion. Your body will adapt and regulate as much as it can in order to prevent this from happening, including increasing your blood pressure. This is a very important part to note, and it's also another reason why we have to cover the basics first. So now that you understand just how important your blood is and some of the functions that it performs, it will be easier to understand why the body's working so hard to get the job done. Now, in the next video series, we'll be talking about blood pressure versus high blood pressure. So stay tuned. Peace. Blood pressure versus high blood pressure. So what is blood pressure? And we're just talking about blood pressure, not high, not low, just blood pressure. So once again, our bodies are made up of trillions of cells. Each one of those cells actually has needs, energy, nutrients, oxygen, and all of that is delivered via the red blood cells. The red blood cells are traveling through the circulatory system. Once again, it measures 60,000 miles long. Now, red blood cells in blood does not propel themselves around the circulatory system. They are actually propelled through the circulatory system by your heart. So when we're talking about your heart is pretty much a muscle, and it has the primary function of pumping blood. Once again, that blood is going to deliver the nutrients and oxygen to the cells. The amount of pressure that is exerted on the arterial walls is the blood pressure. It's just that simple. The amount of pressure that is exerted on the arterial walls is the blood pressure. Now, there are multiple blood pressure regulators that will make sure that your blood pressure is able to adapt when it is needed. And your cardiac output and your systemic vascular resistance will always adapt and regulate itself based on the need at that very moment. So increased blood pressure is actually a sign of increased demand. So when your blood pressure increases, it didn't happen on accident. It happened on purpose because the body has determined that this was a function that was needed at that time. Now, what is high blood pressure? So high blood pressure is an increase in pressure above the norm on a daily basis, chronically. Most patients with essential hypertension have a normal cardiac output, but an increase in peripheral resistance. That's extremely important to remember. Now, high blood pressure is an increase in pressure above the norm on a daily basis, chronically. This means that there is a constant supply of high pressure against the arterial walls. This is very different from the short-lived increase in pressure, as you will soon see. Once again, there are multiple reasons for why the body would increase blood pressure, but those reasons fall into two categories: increased cardiac output or increased systemic vascular resistance. Now, here's the fundamental thing that you need to know about hypertension that most people don't know, but it's very important that we understand it. Now, most people who have essential hypertension have a normal cardiac output, but instead they have an increase in peripheral resistance. This resistance and restriction in the blood vessels allow for less room for the blood to flow. Now, this makes it harder for the blood to be delivered to the body, which ultimately puts your body at risk. You understand that? So most people who have essential hypertension have a normal cardiac output, but instead they have an increase in the peripheral resistance. This resistance and restriction in the blood vessels allows for less room for the blood to flow, making it harder for blood to actually deliver blood to the actual cells. This ultimately puts your body at risk. So, as I've mentioned multiple times before, without blood, our cells simply cannot survive. In medicine, we call this process ischemia or hypoperfusion. Your body will adapt and regulate as much as it can to prevent this from happening, including increasing your pressure. Therefore, this increased vascular resistance must be met with an increase in blood pressure in order for you to survive. So your body overcomes this resistance and adapts to the environment by increasing the pressure, giving you high blood pressure. So a couple questions you may be asking now is, when you look at blood pressure the way I just explained it, your question may be now, why is there an increase in vascular resistance? What is my blood pressure adapting to? And what's causing the resistance? Now, these are great questions. These are high quality questions because they don't ignore the fact that there is actually a function for blood pressure. Increase in vascular resistance or cardiac output can be caused by many factors. And in H-BAMN, we explain it, we break it down, and we summarize it into 7 pressure points. Now, the actual pressure points are a little bit beyond this mini course, but we will summarize it later on. So what is the big deal about high blood pressure? If it's not a disease, then what is it? Well, what you need to know is that high blood pressure is a risk factor. It is, but we need to now find out what is a risk factor. So when we're talking about a risk factor, in epidemiology, a risk factor is a variable associated with an increased risk of disease or infection. Risk factors are determinants or correlational and not necessarily causal, because correlation does not prove causation. Epidemiologists often refer to the term risk factor to indicate a factor that is associated with a given outcome. However, a risk factor is not necessarily a cause. This is a very important slide. I want to make sure that you understand it. Understand that correlation does not prove causation. A risk factor is not necessarily the actual cause. This is a very important slide to make sure you understand. Now, another reason why it's said to be a problem is because high blood pressure has been shown to be a risk factor, once again, for heart disease, which is #1 killer in America, stroke, which is #5, kidney disease, dementia, and blindness. So if I'm saying that high blood pressure is not a disease and it's a risk factor, well, what does that all really mean? Like, what does it really mean? What should we take from this? Well, what you should take from it is that high blood pressure is simply a sign. It is a sign. It should be something that you look at as a check engine light, or just like the way you look at your fever. So if you have a check engine light and you're driving home one day and it comes on, you're not going to just cut the wire to the check engine light. You're not just going to take a piece of tape and put it over the check engine light, because you understand that the check engine light is not the actual problem. But the check engine light actually denotes the fact that there is a deeper underlying problem that needs to be examined. And so what you're going to do is you're actually going to take your car to your mechanic or to AutoZone to actually be diagnosed, and the problem will then be solved from there. Now, looking at your check engine light this way, your check engine light becomes your actual ally, because if it wasn't for the check engine light, you don't even know that anything's going on. And so you can keep driving and then blow a head gasket or blow up your engine. There's multiple things that could actually happen. But because of the actual check engine light, and because you actually listen to the check engine light versus trying to treat the check engine light like the problem, we can now actually solve the real problem. So understand that analogy. The check engine light is not the actual problem. It's denoting the fact that there is a problem. We need to research it. Same thing with the fever. When someone has a fever, yeah, sure, we can give them Tylenol, we can give them ibuprofen, Motrin, we can give them medications to actually help with the discomfort that they're feeling from that actual fever. But at the same time, we understand that the actual fever is not the problem. We understand that that fever represents the fact that the body felt that it was necessary to increase the temperature in order to increase the immune response, because there may be an actual infection. And so we need to actually deal with the infection. You get what I'm saying with that one? The fever is not the problem. The fever actually has a function. By increasing your body temperature, certain viruses and bacteria are not able to survive at that temperature. But also with the increase in actual temperature, your immune process actually increases. And so your blood pressure falls in the same place. Well, the question we need to be asking is, what is making my blood pressure increase? What is my blood pressure responding to? High blood pressure is your body's way of adapting to an environment that requires it to be increased. All right, welcome back. So in this lesson, we're going to cover medications and side effects. So essentially what this video is going to be about is about the myth that medications are safe and effective. Now, I do want to place a warning and a disclaimer. Do not stop your prescriptions without talking to your healthcare provider first. I want to make it very clear here that I am not recommending that you stop taking any medications. Instead, I suggest that you talk to your healthcare provider about your desire to lower your blood pressure naturally. Ask him or her to look over your plan to help you transition into coming off of your blood pressure medications in a way that does not harm your health. So let's talk about this idea that medications are safe. So studies estimate that nearly 50% of all people who are prescribed medications for high blood pressure do not take them as prescribed. Now, what's wrong with these people? Are they looking to have an issue? Why do they not want to be compliant with taking their medication? Well, it's because anytime you chemically alter the body's physiology by overriding the innate regulations and homeostatic mechanisms, you get what the medical community calls side effects. Now, let's look at a couple of these side effects, and this is just a couple. I couldn't even list everything down. We're talking about cough, diarrhea, constipation, dizziness, lightheadedness, erection problems, feeling nervous, feeling tired, weak, drowsy, and a lack of energy, mental fogginess, headaches, nausea, vomiting, skin rash, weight loss, weight gain without trying. Now, if you ask anyone who's ever experienced any of these side effects, they can tell you that it is not fun. I mean, who wants to feel fatigued all day, mentally foggy, or experience erectile dysfunction? Of course, there are medications for those side effects as well. Now, one of the things that I want to point out is that when most people get diagnosed with high blood pressure, they had no idea because they weren't feeling anything. And so essentially what you have is you have people who were not experiencing any kind of actual symptoms. They weren't feeling anything. And then you take and put them on a medication that actually makes them feel sick. And that's a very hard thing to do. You're taking people who were not feeling anything. They were feeling fine. And then you give them medications. You tell them that it's improving their health, but they feel sicker. Why is that? Why is that? Well, once again, we have to look at the actual function of the red blood cells. And so real quick, we understand that the red blood cell supplies oxygen to tissues. It supplies nutrients such as glucose, amino acids, and fatty acids. It also removes the waste from the cells. It has immunological functions, plays a role in coagulation, the transport of hormones, regulating the pH, and regulating the actual body temperature. Now, when you are taking medications, what these medications are doing is essentially they are stopping or slowing down the actual metabolic processes of these cells and also of the delivery of red blood cells to those cells. Now, by slowing down any of these functions that are listed on the screen right now, which one do you think would actually make you healthier if you were to slow it down or stop it? Which one? None of them. And that's what medications are doing. They're slowing down or they're stopping these functions that are listed above. And that's when you have the actual side effects. So let's talk about, is there any other possible side effects? So here's a quote from a medical article. Essentially, blood pressure medications increase blood sugar and insulin resistance. And I quote, large observational studies demonstrate that thiazide diuretics and most beta blockers increase the incidence of new onset diabetes mellitus. Now, here's the actual citation, the link below. But when we're talking about thiazide diuretics, we're talking about what people call water pills. So one of the main ones is that hydrochlorothiazide. People are very familiar with that one. And as far as beta blockers, we're talking about medications that end in the LOL, atenolol, carvedilol, labetalol, metoprolol, propranolol. These are all blood pressure medications. They are considered to be beta blockers, and they have been shown to actually increase your blood sugar and increase your resistance to insulin. You know, this is diabetes. You're taking medications to improve your blood pressure, but those medications at the same time are increasing your insulin resistance, making you diabetic. Well, I guess that's not a problem because they also have a medication called metformin, and I'm sure that one is going to work out just fine, right? Of course not. Now, also to add to that, here's another title of a research that was done at the University of Alabama. And what this one is saying is that blood pressure medications can lead to an increased risk of stroke. And so essentially what they're saying is that the harder hypertension is to control, the higher the risk for stroke is, even if the treatment is successful. Now, Howard is one of the actual physicians over there, and he says that the risk of stroke went up by 33% with each blood pressure medication that was required to treat the blood pressure to their goal. Now, why is this happening? Why are you taking medications, and why are they finding that the actual medications are not safe nor effective? Well, it's because there's actually a reason for your blood pressure being increased. And it's not increased because you don't have medications. It's not increased because you're medication deficient. It's being done in attempts to overcome the resistance so that the blood can still be delivered to your cells. This is a normal adaptive physiological process. And medications simply ignore the actual cause. But at least they're effective, right? At least they're effective? No, unfortunately not. So here's another quote. Most people who are taking blood pressure medications possibly shouldn't. And essentially what this article is talking about is that a panel of independent experts report that drugs used to treat mild cases of high blood pressure have not shown to reduce heart attacks, strokes, or overall deaths. This is what they consider to be mortality and morbidity. Most of the 68 million patients in the United States with high blood pressure have what they call stage 1 hypertension. This is where the systolic number, the top number, is 140 through 159, or the diastolic, the bottom number, has a value of 90 to 99. The new review suggests that many patients with hypertension are overtreated. They are subjected to the possible harms of drug treatment without any benefits. So here's the link down below. Make sure you check that out as well too. So this is just a continuation of the same article, and essentially what they're talking about is the idea, or the term called disease creep. And this is when you have patients who have risk factors for a condition, or they have a milder version of that condition, but they are treated the same as an actual patient who has a severe case of that condition. Jay Swiak, who is the editor of the American Family Physician, notes that disease creep can be seen in the recently created concept of pre-disease, such as pre-hypertension and pre-diabetes. Starting medications in people who only have a risk factor, even before they have any evidence of actual disease, can greatly increase profits by getting more people on medicines for a longer amount of time. Make sure you check out this link, this website, and I'm sure it's only going to inform you more and make your convictions stronger as far as improving your blood pressure naturally. Now, in continuation with this article, they also note that antihypertensive drugs used in the treatment of primary hypertension, mild hypertension, which is 140 to 159 systolic or 90 to 99 diastolic, have not been shown to reduce mortality or morbidity in random controlled trials. And in fact, treatment of these patients caused 9% of these patients to actually discontinue the treatment due to adverse effects. So if you're taking these medications and they come with side effects, and at the same time they're not even shown to be effective, because most patients who have what they call high blood pressure have not been shown to actually benefit in any way from the actual mortality and morbidity standpoint, what does it actually mean when you decrease your blood pressure with medications? What does it actually mean when you chemically alter your physiology with medications? And so this picture right here, it just shows that you have this guy whose blood pressure is on point, right? 140, 120 over 80. But at the same time, he feels horrible. And I've met plenty of patients. I've dealt with plenty of patients that feel that way, and they feel horrible. And the best thing that their healthcare provider is saying is that, hey, well, at least your blood pressure is on point. What does that mean for the actual function of your body, of the actual health, overall health? So essentially what you have is a symbolic victory. This is where the actual symbol is there. You feel victorious as far as the actual numbers go, but as far as actual health and the overall function, you don't feel healthy. All right, welcome back. So in this video, we're going to talk about the causes of high blood pressure. Now, most people don't actually think about the actual function of blood pressure, and that's a problem. But nonetheless, it's going to be my job to make sure we actually think about the function of blood pressure. So if you have what they call high blood pressure, by the end of this course, my goal is to shift your thinking from asking a question of what do I need to take to get my blood pressure down, to asking a higher quality question like what's making my blood pressure increase. See, the first question actually downplays the intelligence of our body, because we're making it seem as if our body's just randomly increasing our blood pressure for no reason. While the second question denotes the fact that our bodies are indeed intelligent and self-regulating, and therefore there is actually a reason for our blood bodies responding and adapting in that way. So in our actual membership area, we have created what we call the 7 pressure points. Now, the 7 pressure points are a little bit too in-depth for this mini course, but essentially this is a summary of them. Now, what you need to know about this summary, and the reason why I feel so confident about the patients and my clients that I help get off of these medications and improve their blood pressure, is because when it comes down to blood pressure increasing or decreasing or improving in any way, there's only 7 ways that this is actually done. And that's what we have right here in front of us as far as being summarized. And so when we're dealing with these 7 points and improving their blood pressure, it's impossible for it not to improve, because these are the only 7 ways to improve it. Now, once again, it's too in depth to actually go through it in this mini course. But that's why when people ask me the question of, is it possible to prevent hypertension? My response to them is absolutely. Yes, absolutely. And the reason is because when it comes to the risk factors for having hypertension, they are broken down into 2 categories. So first we have what they call modifiable risk factors, and then we have non-modifiable risk factors. So let's take a look at modifiable risk factors. So when we're talking about modifiable risk factors, we're talking about certain habits that you have in life that may play a large part in you having high blood pressure. The reason why these are called modifiable is because the actual power resides in you to actually improve these conditions. In other words, if you improve or eliminate these risk factors, the chances of you having high blood pressure dramatically decreases. So let's look at these risk factors real quick. The first one is lack of physical activity. Essentially, people who are not active are likely to be vulnerable to many diseases, not just high blood pressure, but many diseases. So physical activity provides a great form of exercise for your heart and your circulatory system. And then we have the SAD, the Standard American Diet. So essentially an unhealthy diet, more specifically the Standard American Diet, wherever this diet goes, disease is sure to show. The diet is high in processed foods, it's low in vital healing and rejuvenating nutrients. This pretty much makes the Standard American Diet the perfect storm for high blood pressure and almost every other preventable disease that you can think of. Next is excess weight or obesity. More specifically, I'm referring to the actual body fat. So excess body fat puts an additional strain on your already hardworking circulatory system and can cause multiple health conditions. Then we have drinking too much alcohol. So regular heavy use of alcohol can cause many health problems, including heart failure, stroke, irregular heartbeat, arrhythmias. It can also cause your blood pressure to increase dramatically and also increase your chances of cancer, obesity, alcoholism, and suicide and accidents. Then we have smoking and tobacco use. And from there, we have stress. Now, stress is not always a bad thing. So we have 2 types of stress. You have eustress and then you have distress. Eustress is the type of stress that is actually beneficial to the individual. This would be something like resistance training, whereas distress is not so beneficial and can lead to anxiety, depression, and other psychological issues. During these stressful moments, the body releases hormones in order to adapt to the stressor and activates our fight or flight response. But once again, this is intended to be temporary. So things like hating your job, gossip, ratchetness on your Facebook feed, feeling oppressed and hopelessness, feeling a strong dislike for those in your life, not being able to pay your bills, or you're hearing gunshots go off at night as a lullaby and hating where you live can all cause a constant secretion of hormones that will contribute to an increase in blood pressure, diabetes, obesity, and overall shorter span of life. Now, in this next slide, I just want you to see this study. I'm not going to go through the whole thing, but a study was done at the Harvard Medical School, and essentially they came to the conclusion that chronic activation of this survival mechanism impairs health. So when you are chronically stressed out, you can actually impair your health. Now, one thing we need to understand is that being late for work, your body, that stress that you feel, your body's going to interpret that as the same way it would interpret the stress coming from being chased by a lion. Now, I know that sounds pretty dramatic and it almost sounds like it shouldn't be the same, but our physiology doesn't really know about our modern day life. It doesn't really know about our job. It doesn't really know about losing the job. And so essentially your body feels that stress and it feels that sense of danger, and it's going to respond in a way of getting you ready, prepared to either fight or flight. And so that's when all these hormones are secreted. And then you see that what they're talking about is that having that constantly activated can actually impair your health, because constantly being in a state of fight or flight it's going to cause a persistent epinephrine surge that can damage blood vessels and arteries, increasing blood pressure and raising the risk of heart attacks or strokes. This is something very important to know because people don't really take stress as serious as they should take it. But this is just one of the many reasons why it can actually accelerate the decline in your health. Now, something else we want to look into, and once again, this is going to be too in-depth for this mini course, but this is something called endothelial dysfunction. Now, something real quick about the endothelium is that it is the inner lining, the very inner lining of the artery. And so it is actually an organ, is an endocrine organ because it actually secretes hormones. If there was to actually be a brain of the cardiovascular system, the circulatory system, it would be the actual endothelium. Once again, the endothelium is an organ. It is the largest endocrine organ in your body. And I would also make the argument that is the largest organ in general in your body, because if you were to peel it off, it would cover the length and the size of 6 tennis courts. Now, what they're starting to see, and research is starting to move more towards this way, is that endothelium dysfunction may be the genesis of many of these health conditions we are considering to be deadly, such as high blood pressure, diabetes, and sleep apnea, stroke, dementia, memory loss, and a whole other swath of other damaging health issues. And what they're seeing is that a lot of these health conditions are actually starting with the damage of the lining of the endothelium. So let's talk about non-modifiable risk factors. So non-modifiable risk factors mean that there's something that is out of your control and there's nothing you can do about it. So when we're talking about hypertension, these non-modifiable risk factors will be things like age, gender, family history, race, and genetics. Now, of course, I specifically want to focus on the last 2 bullets, family history and race. Now, we always hear as African Americans that we are more likely to have hypertension and heart disease. The general, vague, and misleading reason that is given is because it runs in our family and it's in our genes. Now, being told this followed by the individual actually believing this actually traps them in a mental framework created by the person that is giving them the information, along with the individual that is taking in the information themselves. This is a framework of a reality of eventually becoming sick and that there's nothing that can be done about it. It's a box of hopelessness and giving up. After all, it's in your genes, so you will eventually have high blood pressure, right? Well, the only problem with this mental framework and this reality is that it doesn't exist. You don't have to be sick. You are not destined to be sick. You are not destined to suffer ailment after ailment without any power or control. Always focus intensely on the things that are within your control. Everything else will only serve as a stressor and lead to stagnation. And in the case of high blood pressure, we are definitely in control, and we want to continue to focus on the things that we can control, which would be the modifiable risk factors and not the non-modifiable risk factors. Now, there's 2 major reasons why you want to make sure you focus on the modifiable risk factors versus the non-modifiable risk factor. The first reason is because non-modifiable risk factors such as family history and genetics are actually not a risk factor at all. The risk is eating the standard American diet. The SAD diet is a disease itself. I want to make sure you get that from this actual mini course. Make sure you tell your family, your friends that the standard American diet is a disease itself. It is a disorder in nutrition. Genetically, we are not about that life. And so whenever we're consuming this food on a daily basis, our bodies are trying to adapt to this stressful environment. And so when your body's adapting, and it's doing things such as increasing your blood sugar, becoming insulin resistant, increasing your blood pressure and your lipids, we have to ask, what is our body adapting to? Because if we can find out what our body's adapting to, then we will find the actual disease. And 9.9 times the actual case is that it's adapting to the standard American diet, which is a disease. The second reason is because it has been shown in multiple studies that modifiable risk factors accounts for an average of 90 to 95% when it comes to prevention of hypertension, heart disease, stroke, and other preventable diseases. So essentially what this means is that even if the ratio and genetic component was correct, you are still 90 to 95% in control of your health destiny. Now, of course, some may want to still focus on that 5 to 10%, but I'm not here for that. I'm here to empower you and let you know that you don't have to be sick. Instead of focusing on the 5 to 10%, focus on the 95% of the fact that you are in complete control. All right, so in this lesson, we're going to talk about what exactly do you need to do to improve your blood pressure. So we just listed out everything that essentially causes your blood pressure to be increased. And in order to actually improve your blood pressure, you're essentially going to do the opposite of those other things. So the first step to improving your blood pressure is getting your mind right. Now, this is not a tangible step, so you may not be able to actually touch it and feel it, but it's extremely important because your mindset is the actual foundation for everything, including your health improvement. Now, what you need to know as far as your mindset is that, one, you are not destined to be sick. And I don't want you walking around thinking that this is something that just runs in your family, because it does not run in your family. Not only that, it is not a disease. It is actually a symptom. We need to find out what the symptom is responding to. And the next step is that medications are not safe or effective, and they won't save you. You have to save yourself, and you save yourself by taking the actions that we're laying out in this program right here. Next step is eating real whole foods. Now, I can sit here and write out a long list of foods that you would greatly benefit from as far as improvement in your health and specifically your blood pressure. However, before doing that, I would like to give you the big picture and overall message, and that is eat real whole foods, especially leafy greens. Now, I understand that advice may not be as attractive as a lot of blog articles and posting out there, but this is essentially what nutritional health comes down to. More specifically, when it comes to H-BAMN, our recommendations are make sure you eat 70 to 80% of whole food, plant-based whole foods. That's our basic recommendations. And so this is actually what it comes down to when we're talking about nutritional health. Also, remember, don't let processed foods off the hook. Don't let the standard American diet off the hook. It is the #1 risk factor to any preventable disease in this country. Make sure you remember that. Make sure you tell your family, your friends, your mom, your dad, everyone. Let them know that the standard American diet is a disease, and it is the #1 risk factor for any preventable disease. Now, as a whole, 90% of Americans are not taking in the recommended daily allowance of potassium, making lots of people actually potassium deficient. Now, when we're talking about other races, when they're potassium deficient, we can kind of see that as a cold. It's a problem. It's a big problem when you're potassium deficient. But if we were to actually look at this, a cold versus a flu, when other racial groups are low in potassium, it would be considered to be a cold. However, when you are African American or you're African descent, when you are potassium deficient, this is like having a severe case of the flu or a severe case of pneumonia. And in fact, when they show that people who are deficient, African Americans who are deficient in potassium, and they switch over to eating a diet that is higher in potassium, the results are second to none. So once again, I know for a fact that most of us right now are potassium deficient. We're not eating enough foods that have high potassium amounts. The recommended daily allowance is 4,700 milligrams. And we just simply need to take in way more because it affects us in a very different way. Here's the link below to actually get more information on that. Next, vitamin D. So, spoiler alert, vitamin D is actually not a vitamin, it is a hormone. And this is another case of the cold versus the severe flu. When other racial groups are vitamin D deficient, yes, it does affect them. And yes, it is a bad effect on their overall health. However, when you are African descent and you are vitamin D deficient at the same time, this is like having a severe flu. Understand that being vitamin D deficient alone is enough to not only increase the stiffness in your arterial walls, but to cause a whole slew of other health conditions, making high blood pressure the least of your worries, the least of your concerns. So here's an actual link below to show you and to give you more information about how being vitamin D deficient actually affects your health and how getting a healthy amount of vitamin D via sunshine can improve your overall health. Next, water. Your body is composed of 70% of water. So anything that makes up that much of anything must be important. And I know for a fact that most of us are not drinking enough water. So simply this recommendation is to drink more water. Herbs and tea. So there are plenty of herbs. I mean, a whole long list of herbs. So there's no way I would be able to go into each herb one by one. But essentially, when it comes to the herbal tea, we have 4 teas that have been shown to help improve blood pressure. You have green tea, black tea, oolong tea, and hibiscus tea. Now, the way these teas have been shown to actually help you improve your blood pressure is by providing you with a daily dose of antioxidants such as phenols and anthocyanins that have been shown to have blood pressure lowering effects. Now, out of all these teas, my favorite is hibiscus tea. Now, yes, hibiscus tea has a unique look and taste to it, as well as a unique set of antioxidants that provides nutritional therapy to the endothelium, which assists in repairing your arteries, thus improving your blood pressure. In fact, several studies show that a daily consumption of hibiscus tea was not only shown to improve your blood pressure by just a couple of points, the decrease in blood pressure was shown to be about 7 to 10 points on average. Once again, this wasn't due to hibiscus tea directly working to lower your blood pressure. It was due to the high amounts of several specific antioxidants that were being introduced to your endothelium on a daily basis. This then leads to an improvement in the function of your endothelium, thus improving your blood pressure. I really hope you understand how that went. The antioxidants provided therapy to the endothelium, thus improving the function. This improvement in the function then led to an actual change in the internal environment of the cardiovascular system, which no longer needed to respond to the heightened toxic environment with an adaptation of high blood pressure. Now, what I want us to do right now is to look at this actual graph. So essentially what you're looking at is a 4-week study that was done comparing hibiscus versus lisinopril. Lisinopril is one of the top blood pressure prescribed medications. The thing that I want you to graph from the study is that this was done on Nigerians. This was done on Nigerians who had mild to moderate hypertension. Now, ask yourself, how often are you given health advice that is genetically relevant to you? I'll answer that for you. Rarely. Nonetheless, this was a double-blind, controlled, randomized clinical study. Essentially, Group A received a placebo, and Group B was given the lisinopril, roughly 10 milligrams per day, and Group C received hibiscus tea, about 150 milligrams per day. The results? Well, hibiscus and lisinopril both significantly lowered in blood pressure. However, hibiscus was shown to be more effective. Lastly, it's extremely important to note and mention that several of the participants had to stop the study early due to the side effects of lisinopril medications, such as a chronic dry cough. Now, as far as the hibiscus tea and the side effects, well, there was absolutely no side effects. Let's also look at this study right here, which is one of my favorite. Just in case you're not convinced, let's look at another study that was based on Nigerians who were drinking hibiscus tea versus hydrochlorothiazide, which is usually prescribed to African Americans as a starting therapy. Once again, these patients had mild to moderate hypertension, and once again, both hydrochlorothiazide and hibiscus tea was shown to have a significant decrease in blood pressure, but once again, hibiscus beat out the medication. Let's look at the numbers. Now, I need you to follow me on this one because I'm about to drop a bomb. At the end of the 4-week treatment, the systolic blood pressure was shown to decrease by 12.9 points with the hydrochlorothiazide group and 17.8 points with the hibiscus group. Now, there were similar results as far as the diastolic numbers went as well. Hydrochlorothiazide was shown to decrease it by 9.5 points, and the hibiscus group was shown to decrease it by 11 points. However, 1 week after the withdrawal of treatment, the fall in systolic blood pressure and diastolic blood pressure in the hibiscus group essentially stayed the same compared to those of the placebo group, while the blood pressure returned back to baseline levels in the hydrochlorothiazide group. Now, how could this be? How could you have the hydrochlorothiazide group essentially return right back to where it started at before taking the medications, and the other group who were drinking the hibiscus tea essentially remained the same as far as their blood pressure? Well, that's because the hibiscus tea was actually providing it something beneficial, such as the actual antioxidants, the actual nutrients that was working towards improving the overall function of the endothelium. Now, once again, something that's incredibly important to note is that the hibiscus tea was able to do this without any of the side effects. When we're talking about the side effects with the hydrochlorothiazide, we're talking about potassium depletion, cramps, frequent urination, and the list goes on. But once again, don't take my word for it. Actually look up this research, the study, and you'll see exactly what I'm talking about. So real quick, I want to talk about several other herbs that have been shown to have an overall improvement in your health and your cardiovascular function. One being garlic, which has been used for many cardiovascular conditions, and it's been shown to increase nitric oxide production, which results in smooth muscle relaxation and vasodilation, improving your blood pressure. And then we have hawthorn. Hawthorn has been used in China as treatment for hypertension for thousands of years. The two groups of substances that contribute to hawthorn's beneficial effects on the heart are the flavonoids and the potent antioxidant agents. Essentially, what this demonstrated was the ability to inhibit platelet aggregation and thrombosis, which suggests that this may be useful in preventing strokes by reducing the risk of heart attacks and increasing circulation and inhibiting both the formation of plaque on the arterial wall and formation of blood clots in the brain, heart, and arteries. And then we have ginger. Now, many of us are familiar with ginger, but essentially the way ginger works is that it improves blood circulation and relaxes the muscles that are surrounding the blood vessel. The blood pressure lowering effect of ginger is mediated through the blockage of the voltage-dependent calcium channels. And then we have cat claw herb, which has been shown to also improve blood pressure function and other various neurological symptoms. And then we have flaxseed, which is an annual herb that originated in Egypt. Now, this herb is rich in essential fatty acids that appear to be beneficial for heart disease, inflammatory bowel disease, arthritis, and other health problems. Several studies suggest that diets rich in omega-3 fatty acids lower blood pressure significantly in people with hypertension. And of course, that's just a few. There are many more herbs out there that can actually benefit you as far as your blood pressure and your overall health improvement goes. Now, last recommendation I want to make is to move. Move, whether that be walking around your block every single day, performing exercises, or my personal favorite and my personal recommendation for everyone essentially is high intensity interval training, also known as HIIT. We simply are not moving enough, and we are built to move. And so when we're not moving the way we are actually built to move, this is going to cause a lot of issues. All right, welcome back. So what you have just experienced is a thorough presentation of what high blood pressure is. Not only that, we also explain what causes high blood pressure, which is a very crucial point that you understand. After that, we laid out sustainable and practical lifestyle changes that you need to make in order to improve your blood pressure. It's very important that you don't skip over any of those parts because they're all important. We also talked about medications in this presentation as well. Now, going forward, what are you going to do? So, in conjunction with the lifestyle changes that I strongly recommend, I also recommend that you use some type of herbal supplements to help you out as far as improving your blood flow, your circulation, but also as far as providing nutritional therapy to your endothelium, because the endothelium plays the largest role as far as this whole blood pressure thing goes. And make sure you understand that from watching the videos. And so what we have is we have a package, a stack called REVOLT. REVOLT is a combination of our herbal supplements called Circulation and Flow and our herbal tea called Pressure Tea. The combination of the two is going to help you improve your circulation, your flow, and your overall blood pressure and overall health. Now, because you sat through and you watched this presentation, you understand what high blood pressure is. You also understand what caused high blood pressure. And now going forward, you understand what lifestyle changes to make to radically improve your blood pressure. What I want to offer you is a special discount on our herbal stack we have called REVOLT. It is our best-selling product that we have for high blood pressure, and I want to offer you a special deal. So all you have to do is click on the link above in the description, and it's going to take you over to the page. It's going to tell you more about the product, and it's also going to tell you how you can get the product for a special offer. In addition with that, as a bonus, I'm going to include my protocol that I also use with the actual supplements, the lifestyle changing, and the fasting that I usually have my clients, my patients do. Now, make sure you understand that this is not medical advice. You need to talk to your medical practitioner as far as the medications and anything else going forward. But this is something that I do to my patients, my clients all the time. And it's something that you should check out as well too if your goal is to radically improve your blood pressure and your overall health. So click the link in the description. Go check it out. If you have any questions, comment below in the video. But also in addition to that, please share this video. Share this video out, because I'm sure you have lots of people in your life that could benefit from the information that we just laid out. All right. So I really appreciate you taking the time out to watch this presentation. And until next time, I'll talk to you later. All right.